So in this video I'm going to explain the pharmacological classification of anticholinergic drugs based on the receptor. So we have if we classify the cholinergic receptors, we have three types of receptors. Cholinergic receptors. So we have muscarinic receptors, that's denoted as M, okay, and we have nicotinic receptor, which is symbolized as N, and then we have neuromuscular junction receptor, NM receptor. So these are three cholinergic receptors on which acetylcholine binds and gives action, okay. Muscarinic receptor is further subdivided into M1 receptor, M2 receptor, M3 receptor, M4 receptor, and M5 receptor, okay. And this is the nicotinic receptor, and this is neuromuscular junction receptor, NM receptor, okay. If you wanna get a good concept about these receptors, detailed concept that I will discuss in the pharmacology, in the pharmacology of cholinergic drugs and anticholinergic drugs, that I will discuss in the coming videos. So for that you need to subscribe my YouTube channel so that you can get notified when I will make the video. So now just I am giving the classification, okay. Pharmacological classification depending upon the selectivity of the receptor, okay. M1 selective, M2 selective, M3 selective, depending upon the selectivity of the receptor on which the drug binds and shows anticholinergic action. So we have, depending upon the selectivity, we have anticholinergic drugs are classified anticholinergic drugs are classified as, first we will see this is a muscarinic receptor, nicotinic receptor, and this is neuromuscular junction receptor, okay. This is a postganglionic receptor. Muscarinic receptors are postganglionic receptors. They are also located also some of the receptors that we will discuss in the detail. For now you just focus on the selectivity, okay, because in several competitive exams this becomes very important competitive question, MCQ question. That's selectivity, which of the drug is non-selective muscarinic receptor, and which one is M1 selective, which one is M2 selective. Depending upon that, it becomes one of very important MCQs, okay. So you have to focus on this, okay. So muscarinic receptor, so we have here M1 receptor, M2 receptor, M3 receptor, M4 receptor, M5 receptor. So the drugs which are selective on M1 receptor, the examples of these drugs, first we will see the non-selective, okay, which binds on all five muscarinic receptors, M1, M2, M3, M4, M5, and blockers all the receptors competitively, okay. The example, there is only one example, that's atropine, one of the important drug, okay. So atropine is non-selective. So here I will write here, one minute. So muscarinic receptors, they can be classified as non-selective, antagonists, non-selective antagonists, and we have another example we have, that is selective antagonists. Non-selective example, that's This atropine, hyoscine, and scopolamine. Okay, so atropine, hyoscine. See, actually, this atropine and hyoscine, it's a single drug, and they are different from each other depending upon the optical isomerism. Okay, this atropine, this is dextro level, DL, DL hyoscine. Okay, and then my scopolamine, this is L hyoscine. So they are same, but the difference is just optical isomerism. This makes them different. Okay, so atropine, and another we have example, that's hyoscine, scopolamine. Sorry. Yes, scopolamine. Okay, scopolamine. So this is the non-selective. Atropine and scopolamine, these are non-selective muscarinic antagonists. Okay. Now selective. Selective is further subdivided as M1, M2, M3, M4, M5. M1 selective antagonist, M1 selective receptor antagonist. So we have three important drugs. That's pirenzepine, talenzapine, and trihexyphenidyl. So this the location of M1 receptor is in the gut and also in the CNS, central nervous system. Okay. Yes. So the M1 selective receptor antagonist example is pirenzepine, talenzapine, trihexyphenidyl. Okay. Then we have M2 selective. M2 selective. M2 selective. So M2 selective, we have example methostramine. Only one drug we have under this class. Okay, methostramine. Then M3. Sorry. Here, okay, here I will write M3. M3 we have it's a very complex name. Hexahydro hexahydroxylidiphenediol. Okay, so this is the M3 selective antagonist. Then M4 we have M4 we have himbacine. M5. See, M5 till now we don't have any selective M5 receptor antagonist, but this tropicamide, it's still under development. But tropicamide have shown some selectivity on M5 receptor. Still, it's not clear, but some of the research, some of the literatures, they have shown that tropicamide is showing selective M5 selectivity. Okay, tropicamide. tropicamide. Still, I will put the question mark here. Okay, so this is the muscarinic receptor antagonists. So muscarinic receptor antagonists, they are classified as non-selective and selective. Selective have example atropine and scopolamine, and one selective pirenzepine, talenzapine, trihexyphenidyl, and two selective antagonist is what is it? This is methostramine, and M3 we have hexahydroxysiladiphenidiol. Okay, you see the pronunciation of this, right? Because it's a complicated name. Okay, then M4 we have himbacine, and M5 it's still under development, but some of the literature have shown that M5 tropicamide is showing selectivity on M5 receptor. So these are the M5, these are the muscarinic receptor antagonists. Now we will see, you can take a screenshot if you want to take screenshot. Okay, and then we have second one, we have that's nicotinic receptor. See, this receptor, that's the nicotinic receptor. It's located in the ganglion. Do you know what's ganglion? See, a brief explanation I will give. This is the, you know, what is this? This is brain, okay, and this is spinal cord. Okay, brain and spinal cord, it forms central nervous system. So the nerve fibers which originates from brain or spinal cord. For example, here one of the nerve originates here. This is the dendron. Okay, this is the axon. Okay, so this nerve fiber which originates from central nervous system, it is called the preganglionic nerve fiber. Preganglionic nerve fiber. And the junction after this, see, this is the gap here. You know that this gap is called synapse. After this, another nerve fiber originates, which is called postganglionic nerve fiber. This is the dendron, okay. And this connection, that's the preganglionic and postganglionic, the relay between these two, these are called ganglion. These are called ganglion. And the nerve fiber which originates from the central nervous system is called preganglionic nerve fiber. And another nerve which which connects after this which is after this preganglion nerve is called postganglion nerve. Okay, and remember that preganglionic, in the preganglion, in case of both autonomic nervous system, that's cholinergic as well as adrenergic nervous system, the preganglionic neurotransmitter is only one, that's acetylcholine. Then the postganglionic nerve fiber in case of adrenergic nervous system is noradrenaline. Okay, so this is a brief concept about what's the ganglion, because this nicotinic receptor, it is located in in preganglionic nerve fibers. Okay, so the drugs this nicotinic antagonists, they are also called as ganglionic antagonists. Ganglionic antagonists. Actually, we have to see also the ganglionic agonists. I think here is only I'm going to explain only here the nicotinic agonists, that is the ganglionic stimulants as well as ganglionic antagonists. Here I will explain. Okay, because it will be not feasible to make a separate video on it. Okay. Or else this is another huge classification, that's the nicotinic antagonists and nicotinic agonists, that's ganglionic stimulants as well as ganglionic blocking agents. And this then NM, that's neuromuscular receptor agonist as well antagonist. It is itself a huge classification. So these we are going to see in the coming videos. So subscribe my YouTube channel and press the bell icon so that you can get notified whenever I am making such informative videos. And if you have any topic on which you wanna have some explanation, you wanna get explanation, so you can put your doubts and the topic in which you want explanation on the comment section, so I can make the videos on that also. And if you have any doubts, so please put the comments in the comment section, so accordingly we can go. Okay, so in the coming video we are going to see this classification, that's the nicotinic agonists and antagonists, ganglionic blocking agents as well as ganglionic stimulants. It's itself a huge classification, that's why I quit here. So next time, in the next video, we will discuss this classification.